Did you know that up to 63% of adults in the United States have some form of childhood hidden trauma that they're not even aware of? Carrying hidden trauma has been shown to triple your chance and risk for lung disease, for heart disease, and reduce life expectancy by up to 20 years, 2 decades. And that's why in this video, I'm going to share the top 5 signs of hidden trauma so you can recognize it and get help. But first, why would childhood trauma be hidden? Good question. See, if you are somewhat functioning, right? You have a job, you have a couple of friends, maybe you are in and out of a relationship, you're functioning okay, but you're feeling bad. You're feeling sad, you're feeling irritable, you're feeling anxious, and you go to the doctor. Because you're functioning okay, you'll likely be misdiagnosed with something like depression or anxiety or ADHD or even a personality disorder. And they'll often may start you on medications and send you to talk therapy. This is because childhood trauma, which is called CPTSD, is not even recognized in the DSM-5, which is the Bible the Bible by which mental health professionals in the United States diagnose diseases and disorders, right? So if it's not in the Bible, if it's not in the book, you're not going to get diagnosed with it. So instead you get the wrong diagnosis and you get sent to talk therapy, which if you have hidden trauma is like putting a Band-Aid on a broken bone. It not only doesn't help, but it can also make matters worse. So let's look at the 5 hidden signs. Number 1 is what I call intellectual hypervigilance. Sounds like a mouthful, but all it means is that you're constantly waiting for the other shoe to drop. Okay? This makes you feel annoyed, suspicious. You're trying to figure out the intention behind other people's words and actions. You feel anxious in social situations. You feel powerless. You are not sure if other people can be trusted or not, right? When you have this sort of intellectual hypervigilance, there'll be 3 signs that'll come up. Number 1, all your feelings are often thoughts. So when I ask some of my clients who come to me with intellectual hypervigilance, I say, okay, so you described a situation. What are your feelings about it? They will say things like, I feel like no one cares. I feel like my spouse isn't curious about my needs. I feel like the world isn't trustworthy. Or I feel like I can never quite catch a break. All of these are thoughts. They're not feelings. They're stories. But because with intellectual hypervigilance, you are so living in your head, you don't know what your actual emotions are. That's one symptom of intellectual hypervigilance. Number 2, this one is that you'll have the same 10 or 20 thoughts about each situation over and over, kind of like a broken record. So when I ask someone with intellectual hypervigilance about an issue, maybe they're struggling to agree on finances with their spouse. When I ask them about that, they will mention and repeat the same 20 thoughts over and over and over. Nothing new. Even if we ask 3 months later, it'll be the same 20 thoughts. That sort of broken record is a big hint that there's intellectual hypervigilance going on. And number 3, because of all this, you're not really there, right? In your life and with the people that you care about. There is cognitive fog between you and them, between you and life. You're not actually seeing reality. You're seeing just a reflection of your own thoughts. Because of that, we'll keep finding more and more cues of threat, if you will, and we'll keep adding it to our ruminations, and the ruminations grow bigger, and eventually there's a chasm of disconnection between us and the things and people that we care about. So that's intellectual hypervigilance. The second sign of hidden trauma is emotional numbing or dissociation. So when I was in my 30s, I was doing a fellowship at Harvard in psychiatry. And from the outside, I was really doing great. I mean, I was the pinnacle of the academic world in psychiatry. I was functioning really well at work. It looked like I was killing it, except for one thing. At the end of the workday, when I came home, I would sort of crash. I had no energy left for anything else. I would literally veg out, stare at the TV, order pizza, just not do much of anything basically. Rarely I'd go out and maybe see a friend, but it would take a lot of energy, right? But no one knew this from the outside. This sort of withdrawal from life and spacing out and not really being in touch with even my own body or my emotions is called emotional numbing or dissociation. This is a really big clue for hidden trauma that is often missed because, again, like I said, from the outside, it looks like you're living a great life, as it did for me. So even I missed that I was having hidden trauma and suffering from it until it showed up in failing relationships. So that's the emotional numbing and dissociation. Now, to understand why this happens, we have to really know what's happening inside of our nervous system. So I'm going to show you a little primer on how the nervous system is organized and what's going wrong in our nervous system for those of us with hidden trauma that puts us into these emotional numbing states. Okay, so let's get to it. All right, so our emotional nervous system, the part of our nervous system that controls emotions, is divided into two branches. One is the sympathetic, and the other one is the parasympathetic. Now, when the sympathetic is working well, what it's doing is keeping us alert, focused, and energized, ready for action, planning, focusing, problem solving, and being alert. When it is over functioning, it goes haywire, and that's when we get angry, anxious, annoyed, ruminating, panicked. So notice that we actually do need the sympathetic nervous system to be there because we need to be able to be alert and focused and make plans and follow them through. The problem is when it goes haywire, we get overactivated. Now, this, even though it's a problem, at least it's so evident because you'll be getting into trouble at work or at home, enough for it to ring a bell for you and for those around you, and you'll probably get the help that you need, or at least start to get the help that you need. Now, the other one is the parasympathetic. This one, when it's functioning well, it causes you to what we call rest and digest. Right? Think about after a Thanksgiving meal, you're surrounded by your friends and family, you've had a good meal, you feel content, you're a little bit sleepy, you can't really focus all that well or problem solve, but you are sort of recuperating and relaxing and restoring and digesting at that time. This is important. We need to be able to recuperate our energy so that we can then use it for the next period of focused problem solving, right? So when these are functioning well, we need them. They're good systems. When this one over functions and goes haywire, you get emotional numbing. And this is what I was experiencing when I was in fellowship, right? This is when you are checked out, withdrawing from people around you, overworking or spacing out, not really in your body, not really aware of your emotions at all. You feel like there's a bubble around you and real life is happening out there and you can't quite feel it or experience it. You feel blah most of the time. This one is harder. That's why it's more of a hidden sign because you're functioning okay in the external world. So this one can really get you in trouble because you can let years go by which in this state, which worsens your overall emotional nervous system, which means that eventually when it does crash, you'll end up in a lot more trouble. Now, the next sign of hidden trauma is what we call emotional dysregulation. What's that? What's different? So let's look at this again. This is when your nervous system is functioning well, okay? You wake up in the morning, you're getting ready, brushing your teeth and drinking coffee, getting energized, and then you go settle in at work and you're in a lull and you take a break and maybe have coffee with a friend or chat with a colleague, and then you focus again and maybe you're seeing patients or doing a surgery, and then you have a lunch break, and then you're going through the evening traffic, and then you relax at home for a little bit, and then there's the evening rush of getting the kids through dinner and bedtime, right? So these mild ups and downs are normal. They are part of a healthy nervous system. But when you're inside of this area, which is called the window of tolerance, when you're inside this window of tolerance, even though you have some ups and downs, overall life feels manageable. Feels like you got this, you like your life, you like the circumstances around you. You might get a little annoyed, but overall things feel pretty safe and good. Now notice, remember earlier I said you can have sympathetic hyperarousal? That's when you overshoot and you get that angry, anxious, tired. Tired and wired is another way we call this, is when you're in sympathetic hyperarousal. The other one that is emotional numbing is when you go below this baseline and you go into numbing. The third sign is when you go up and down and up and down. That's emotional dysregulation. That's a core symptom of hidden trauma. It often means that you've gotten so burnt out with the angry anxiousness that when you've had a period of that, you crash and you sort of go numb and don't feel much of anything and space out in order to recuperate. Then you go back all the way up here. Then you come back down here. And that volatility in your emotions shows up as a lot of chaos in your relationships. That's emotional dysregulation. And as I said, is a core symptom of hidden trauma. Okay? When someone has emotional dysregulation, I've noticed that often they don't know what their needs are, except for when their needs are not being met. Then they suddenly feel humiliated or abandoned and they have a strong reaction and then crash and go into numbing. But if you ask them, what are your needs? They can't specify what it is that they actually want or need. So they don't have language for it. They can explain it to someone else, but they're constantly annoyed that their needs are not being met. Right? That's a big symptom of emotional numbing and dysregulation. All right, so number 4, the fourth sign of hidden trauma is what I call the glass ceiling effect in your career. A lot of my clients are physicians and they did really well often in school, right? Many of them were thought to be high achievers even as children, maybe even a genius or child prodigy. A lot of people who they grew up with, their parents and siblings and aunts and uncles, expected them to succeed on a big level. Even in high school, they often get the most likely to succeed. And they do succeed. I mean, after all, they're physicians. But there's a gnawing feeling in many of my clients when they come to me that they've hit this glass ceiling and they're not able to sort of break through. They feel like they are living not quite up to their potential. They see people that didn't do as well as them in school. They know that that person is maybe less knowledgeable about a particular topic, but they seem to be more successful. So there's this sense of shame, inadequacy, imposter syndrome, jealousy, and a feeling of I'm working, but I'm not able to break through this glass ceiling. Something is wrong with me. You know why this happens with hidden trauma? It's because you're spending so much of your time and emotional energy on just managing this chaos inside of your emotional nervous system, the emotional dysregulation and the numbing and the overwhelm. We don't even know that we're spending that much time and energy managing it because it's the only brain we've known, right? There's nothing to compare it to. So we think everybody must have these things. How come they're successful? I must be lazy. I must not be as smart as I thought I was, or something is wrong with me or whatever. But the truth is, most people without hidden trauma are not spending a lot of time managing their inner state. So they have more time and energy, which is the two most precious resources that we have as human beings. They have more of those resources to spend on creativity, taking risks, and doing big things in their career. People like you and me with hidden trauma, we're spending all of those resources, or at least 80% of it, just maintaining. This is why, even though we have a good life, we fall short of a great life sometimes. So that's the fourth sign. The fifth sign is sex and libido issues. People with hidden trauma, when they come to me often, will have a lot of shame around their sexual desires and behaviors and impulses. with hidden trauma, we often have specific stimuli that tends to excite us. We might get very attached and attracted to someone all of a sudden. And then sometime later, we lose that attraction and we don't know why. We might have some theories, but we notice that it goes up and down like that in most of our relationships without being able to control it. We have so much shame around this that we tend to compartmentalize it, okay? So whenever we compartmentalize and split ourselves in our minds like that, we end up doing behaviors on the side that we're ashamed of. So you might have a porn addiction, or you might be flirting with people or sexting with people or even having an affair. And because you have compartmentalized, you take those sexual impulses and act them out in this secret world over here so that you can maintain this other world where you don't have those impulses. And this splitting means that you end up acting different in different situations. So much so that you don't even know who you are after a while. Many of my clients will tell me, I have lost myself. I don't know who I actually am. I don't know what I want. I don't know what is the real me and what is the false me. So this sort of compartmentalizing is very common in hidden trauma, and sex and libido is one area where this splitting and being different people at different situations will show up. Any of these symptoms and signs, if you have them, please know that there is a way out. If I can do it, anyone can do it. I had all of these and many more. If I can do it, if my clients can do it, you can do it. There is a way out. But it's not through just talk therapy. That's not going to do it. Okay? So if you want to know the 3-step system that I use to completely heal my own hidden trauma, I'm going to be in the next few days releasing a video. And in that video, I'm going to go in depth on the neurobiology of why talk therapy alone doesn't work for hidden trauma and exactly what does. So if you want to be notified when that video goes live, hit subscribe below so YouTube will let you know and you won't miss it. I'll see you there.